Question 1. The RN delegates a task to a UAP. Which follow-up action is most important? A. Assume the task is completed correctly. B. Review the outcomes with the UAP. C. Thank the UAP and move on. D. Document that the task was assigned. Answer. B. Review the outcomes with the UAP. Question 2. Which client is safe to assign to a UAP? A. Client with new onset seizures. B. Client post-fall with suspected fracture. C. Client requiring assistance with meals. D. Client with chest pain. Answer. C. Client requiring assistance with meals. Question 3. What task can the RN safely assign to the LPN? A. Admission assessment. B. Titration of vasopressor drip. C. Reinforcement of dietary teaching. D. Interpretation of lab results. Answer. C. Reinforcement of dietary teaching. Question 4. What is the best initial action when the RN identifies incomplete documentation by a UAP? A. Rewrite the documentation. B. Ignore it unless there's harm. C. Coach and clarify documentation standards. D. Report the UAP to the nurse manager. Answer. C. Coach and clarify documentation standards. Question 5. Which task should be performed only by the RN? A. Recording a blood pressure. B. Conducting an admission history. C. Applying elastic compression stockings. D. Helping a client to ambulate. Answer. B. Conducting an admission history. Question 6. A client has a sudden change in mental status. What should the nurse do first? A. Notify the provider. B. Ask the UAP to take vital signs. C. Perform a quick focused assessment. D. Recheck the march. Answer. C. Perform a quick focused assessment. Question 7. What task is not appropriate to delegate to a UAP? A. Repositioning a client every 2 hours. B. Recording oral intake. C. Assessing a pressure ulcer. D. Weighing a client daily. Answer. C. Assessing a pressure ulcer. Question 8. The nurse must delegate care during a mass casualty event. Which client is best for the LPN? A. Client with GCS score of 6. B. Client with open chest wound. C. Client with fractured arm and stable vitals. D. Client with active seizures. Answer. C. Client with fractured arm and stable vitals. Question 9. A new graduate nurse is unsure about a delegated task. What should the charge nurse do? A. Tell them to figure it out. B. Provide direct supervision and teaching. C. Reassign the task to a UAP. D. Avoid assigning anything challenging. Answer. B. Provide direct supervision and teaching. Question 10. What is the priority when multiple call bells are ringing? A. A client asking for water. B. A client requesting bathroom assistance. C. A client with dyspnea and high anxiety. D. A client needing pain medication. Answer. C. A client with dyspnea and high anxiety. Question 11. The RN delegates feeding a client with mild dementia to a UAP. What is a required follow-up? A. Ask the UAP to document everything. B. Ask if the client tolerated the meal. C. Observe the UAP directly. D. Tell the family the client ate. Answer. B. Ask if the client tolerated the meal. Question 12. The nurse must intervene when which task is delegated to a UAP? A. Collecting routine urine specimen. B. Feeding a client on aspiration precautions. C. Turning a bedbound client. D. Assisting with oral hygiene. Answer. B. Feeding a client on aspiration precautions. Question 13. The LPN reports a post-op client's HR is 118 BPM. What should the RN do next? A. Recheck the pulse. B. Ask the UAP to check the temperature. C. Assess the client for bleeding. D. Wait and reassess in 30 minutes. Answer. C. Assess the client for bleeding. Question 14. A UAP refuses a delegated task. What is the best response by the RN? A. Report the UAP immediately. B. Ask for the reason and address concerns. C. Assign the task to another team member. D. Do the task yourself. Answer. B. Ask for the reason and address concerns. Question 15. Which of the following should not be assigned to an LPN? A. Reinforcing wound care instructions. B. Giving PO meds to a stable client. C. Performing an initial neurological assessment. D. Collecting a sputum specimen. Answer. C. Performing an initial neurological assessment. Question 16. Which client should the RN assess first? A. A client reporting calf pain and swelling. B. A client needing morning hygiene. C. A client asking for a warm blanket. D. A client with BP 132/84 mmHg. Answer. A. A client reporting calf pain and swelling. Question 17. The RN delegates vital signs for 4 clients. Which report requires immediate follow-up? A. BP 142/88 mmHg. B. Temp 99.0 degrees Fahrenheit. C. HR 48 BPM. D. RR 20 per minute. Answer. C. HR 48 BPM. Question 18. What is a key component of effective delegation? A. Only assigning tasks the nurse dislikes. B. Ensuring the delegatee understands the task. C. Giving all responsibility to the UAP. D. Avoiding any follow-up after delegation. Answer. B. Ensuring the delegatee understands the task. Question 19. The RN delegates dressing assistance to a UAP. The client refuses. What should the nurse do? A. Document the refusal. B. Encourage the client to accept help. C. Notify the provider. D. Assess the reason for refusal and intervene. Answer. D. Assess the reason for refusal and intervene. Question 20. A client with Alzheimer's is wandering into other rooms. What is the best action? A. Apply restraints. B. Redirect and engage the client in a simple task. C. Give a PRN sedative. D. Isolate the client in their room. Answer. B. Redirect and engage the client in a simple task. Question 21. A nurse is assigning tasks. Which task is best suited for an experienced LPN? A. Initial assessment of a client with chest pain. B. Administering an 4-push medication. C. Monitoring a client receiving a blood transfusion. D. Changing a dressing on a chronic wound. Answer. D. Changing a dressing on a chronic wound. Question 22. Which task is most appropriate for a UAP? A. Administering oral medications. B. Reporting blood sugar results to the provider. C. Assisting a client with ambulation to the bathroom. D. Teaching a client about dietary restrictions. Answer. C. Assisting a client with ambulation to the bathroom. Question 23. A UAP reports a client is confused and climbing out of bed. What is the nurse's priority? A. Restrain the client for safety. B. Assign the UAP to remain with the client. C. Notify the healthcare provider. D. Turn on the bed alarm. Answer. B. Assign the UAP to remain with the client. Question 24. Which client is appropriate to assign to an LPN? A. Client requiring 4 chemotherapy. B. Client with a new tracheostomy. C. Client needing reinforcement of insulin administration technique. D. Client requiring detailed education on anticoagulation therapy. Answer: C. Client needing reinforcement of insulin administration technique. Question 25. A UAP refuses to take vital signs for a client with isolation precautions. What is the best response? A. Reassign the task immediately. B. Ignore the situation. C. Ask the reason and provide education or PP support. D. Notify the nurse manager. Answer: C. Ask the reason and provide education or PP support. Question 26. A client suddenly develops slurred speech and facial droop. What is the nurse's first action? A. Call the provider. B. Notify the family. C. Perform a focused neurological assessment. D. Give PRN pain medication. Answer: C. Perform a focused neurological assessment. Question 27. What is the best action if a UAP completes a task incorrectly? A. Reassign all duties. B. Ignore it unless the patient is harmed. C. Intervene immediately and provide corrective instruction. D. Complete a disciplinary report. Answer: C. Intervene immediately and provide corrective instruction. Question 28. Which client should the nurse assess first? A. Client reporting mild constipation. B. Client complaining of severe headache and vision changes. C. Client needing morning medications. D. Client with low-grade fever. Answer: B. Client complaining of severe headache and vision changes. Question 29. The nurse assigns a UAP to ambulate a post-op client. What statement requires correction? A. I will assess the client's pain before we walk. B. I'll make sure the path is clear of obstacles. C. I'll report if a client feels dizzy. D. I'll help the client use a gait belt. Answer: A. I will assess the client's pain before we walk. Question 30. Which action by the nurse reflects effective delegation? A. Giving a UAP permission to interpret blood glucose levels. B. Assigning a client with respiratory distress to an LPN. C. Delegating hygiene care for a stable client to a UAP. D. Asking a UAP to teach a client about activity restrictions. Answer: C. Delegating hygiene care for a stable client to a UAP. Question 31. Which task must be performed by the RN? A. Obtaining a urine sample. B. Performing a sterile central line dressing change. C. Feeding a client with swallowing difficulties. D. Measuring fluid intake. Answer: B. Performing a sterile central line dressing change. Question 32. What is the first step in safe delegation? A. Assign the task based on staff availability. B. Match the task with the individual's competence and legal scope. C. Wait to see who volunteers. D. Delegate to the most experienced team member. Answer: B. Match the task with the individual's competence and legal scope. Question 33. UAP documents vital signs, but the RN suspects they weren't taken. What is the best response? A. Confront the UAP in front of others. B. Reassign all responsibilities. C. Privately ask the UAP to explain the discrepancy. D. Ignore and retake the vitals yourself. Answer: C. Privately ask the UAP to explain the discrepancy. Question 34. Which task is safest to delegate to an LPN? A. Initiating a teaching plan. B. Administering a unit of blood. C. Assessing for adverse effects after sedation. D. Monitoring and foresight for redness or swelling. Answer: D. Monitoring and foresight for redness or swelling. Question 35. What is the most important responsibility when supervising delegated tasks? A. Ensure tasks are completed quickly. B. Check documentation only. C. Confirm client outcomes are achieved safely. D. Let UAPs report issues at end of shift. Answer: C. Confirm client outcomes are achieved safely. Question 36. A UAP is assigned to feed a client with dysphagia. What should the nurse do? A. Allow the UAP to proceed. B. Observe the UAP for safety before continuing. C. Cancel the task and do it yourself. D. Provide written instructions only. Answer: B. Observe the UAP for safety before continuing. Question 37. Which client should be seen first at the start of the shift? A. Client with blood sugar of 210 milligrams per deciliter. B. Client with pain rated 4 out of 10. C. Client with a low pulse oximeter reading of 86%. D. Client due for a wound dressing in 30 minutes. Answer: C. Client with a low pulse oximeter reading of 86%. Question 38. Which behavior by a nurse demonstrates improper delegation? A. Asking a UAP to assist with turning a client. B. Instructing a UAP to document client education. C. Assigning vitals on stable clients to UAP. D. Having UAPs help with ambulation. Answer: B. Instructing a UAP to document client education. Question 39. An LPN is caring for a stable client with a PEG tube. What task is appropriate? A. Administering 4 antibiotics. B. Performing discharge education. C. Giving tube feeding via PEG. D. Creating a nursing care plan. Answer: C. Giving tube feeding via PEG. Question 40. The RN assigns the UAP to assist with postmortem care. Which instruction is most important? A. Notify me when the room is clean. B. Remove all 4 lines and devices. C. Handle the body with dignity and privacy. D. Place the body bag at the foot of the bed. Answer: C. Handle the body with dignity and privacy. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.